Awake anesthesia is really a very advanced form of anesthesia. It's easy to put a patient to sleep, but once a patient's asleep, it's difficult to move them around. It's very dangerous in some respects. There are blood clots and malignant hyperthermia and a lot of things that can happen. It tends to be very expensive, up to $2,500 an hour just to go into an OR and have an anesthesiologist put you to sleep. So we, about 20 years ago, myself specifically, started to try to do more and more cosmetic procedures using just very light sedation, usually oral sedation, and numbing medicines of different kinds. And when Dr. Klein came along with tumescent anesthesia, it really opened the doors wide open to be able to do a whole variety of procedures, not just liposculpture procedures, but plastic surgery procedures under anesthesia that doesn't require general surgery and general anesthesia. And so we have evolved this to a very fine art where we can keep somebody comfortable for up to 8 to 12 hours, have it very inexpensive and very safe. So we do a full line of cosmetic and plastic surgery procedures, including breast implants, facelifts, eye lift surgery, mastopexy, fat transfers to the breast, and liposuction, tummy tucks, and there's almost no cosmetic procedure or plastic surgery procedure that we haven't done under awake anesthesia. Not every patient is a candidate, but when you're a candidate, it's amazing how we can get a very cost-effective and refined procedure done, because we're not looking at the clock, we're not looking at the watch. We're not focused on, oh my gosh, if I take an extra half an hour, the patient's going to have to pay $1,500 more. I better get going. We have the luxury and the ability to take time and take the time it takes for a patient to get their result. So this has really become an amazing practice for me, where essentially every patient that we operate on currently, we do under awake anesthesia, which is safe, cost-effective, and the patient can help me with the procedure because they can roll over onto their side so that I can do a little bit better liposuction. They can turn their head for a facelift. They can sit up at surgery and look at their breast implants and say, Doc, you know, that's the look I'm looking for. And then we keep that implant. So awake anesthesia is totally amazing. Come in and see us for a free consultation. We'll show you a book of all of the procedures we've done under awake anesthesia and see if you're a candidate and recommend what specific awake anesthesia you'll need to have your procedure done. Thank you.